Today we'll be talking about the step back technique. The step back technique for this will be the step back technique for the biomechanical preparation, or the BMP. So the step back technique involves the use of a K file to complete the biomechanical preparation. The first step towards the step back technique is, of course, the axis opening. After the axis opening, we will ascertain our working length. So since we are using the hand files, our working length will be determined by the use of a K file, most probably a 10 number K file, and we can use a radiographic method, or we can use a apex locator to determine our working length. So in step back technique, we must know a term known as a MAF. That means that is a master apical file. What is a MAF or a master apical file? So the step back technique goes this way. After doing the axis opening, we will determine which file snugly fits at our apex. Again I'll tell you. So we have to determine what size file snugly fits, or what file is snug at the apex. So imagine we have done the axis opening for this tooth. Now we will take a 10 number file and we will try to reach the working length. Suppose this is our file, 10 number file. So we will, and definitely there are some things that you must take in account. The first thing is to do a coronal enlargement. We should enlarge the coronal part of the orifice. Now this I'll demonstrate by using a H file. And after we do a coronal enlargement, we will take our 10 number file and we will put the file and we will try to reach the apex. So the step back technique is called step back because we are trying to reach the apex first. Then we will try to prepare a canal in a flared path. So we will try to take our file to the working length. A 10 number file will reach the working length, and then we will try to determine which file binds snugly at the apex. For example, suppose our 10 number K file is loose till the apex. Our 15 number file is snug at the apex. So this is a old rule we will be following in the step back technique, that we will enlarge the apex to 2 numbers more than the file that snugly binds at the apex. So if our 15 number K file is snug at the apex, so we will enlarge 2 sizes. So after 15, 20 comes, 20 number, then 25 number. So 25 will be our master apical file. So we will prepare our apex till 25 number file. So this will be our master apical file. Then we will start our step back technique. So what we will do is, our 25 number file will reach the apex. Now we will be increasing the sizes of the files and we will decrease the working length by 1 millimeter by each file enlargement. So if our 25 size is the master apical file, then we will reach, for example, if our working length is suppose 21 millimeters, so 21 mm it will be 25 number K file. At 20 mm we will be enlarging till 30 K file. Okay, so our working length will be going short by 1 millimeter and our file size will increase. So at 19 millimeters our canal will be enlarged till 35 number K file, and so this way we will get a tapered shape of the canal. So this is how we do a step back technique. This will all be demonstrated on an extracted tooth in a while. Just to clear your concept, I'll again tell what is MAF, or the master apical file. So imagine this is a distal canal of the lower molar or the mandibular molar. Suppose this is the distal canal. So usually suppose we insert our 10 number file, and it is very loose at the apex, right? It is very loose at the apex. We take a 15 number file, again it is very loose at the apex. We go to the next size, that is a 20 number file. Suppose it is also very loose at the apex. So we go till the 25 number file, and suppose our 25 number K file, it binds at the, or it snugly fits at the apex. So we will have to enlarge this 25 number apex till two sizes, that is 30 and 35. So 35 will be our MAF, or the master apical file. So the 35 will be our master apical file. So we will be enlarging our apex till two sizes from 25, that will be 35 number, that will be our master apical file. So what we will do is, we will gradually insert the files in increasing taper, and we will in increasing diameter, and we will enlarge the apex till 35 number K file. So suppose our working length is 20 millimeters. So we will be enlarging the apex till 35 K file till 20 mm, that is our working length. Now we will keep on reducing the working length by 1 millimeter, and the file sizes or the diameter of the file will keep on increasing. So at 19 mm we should have 40 K file. At 18 mm we should have 45 K file. This is how we increase the taper. So what we are doing is, we are trying to increase the taper of the canal, because we are continuously increasing the file diameters. So let us go to the extracted tooth and let us see how we can demonstrate this.